OsteoConnect method of shoulder dislocation surgery. OsteoConnect method is a very new technique. It's an innovative technique developed by Dr. Taverna, and this is a technique which has been developed by Smith and Nephew, and this is one of the most innovative and best technique to fix bone block in cases of bone loss in shoulder instability. Those patients who have bone loss along with shoulder instability can be treated with bone block surgeries. Traditionally, the bone block surgery was performed by using screws, but in that case we need to do sort of an open surgery with fixation, and it is difficult to put screws with arthroscopic techniques because of the difficult angles and in between neurological tissues. To circumvent that problem, bone block surgery with the use of double buttons was developed. This technique was also being popularized by Dr. Pascal Bailou, and this technique basically will depend on two buttons and intervening fiber sutures, and these two buttons will compress the bone block against the glenoid. This is acting like a bolt and will lead to a very strong fixation of the bone block. Now you can use one set of buttons, that means two buttons, one anterior and one posterior, and that is the classical way to do it as described by Dr. Pascal Boileau for arthroral ataxia. Or you can use two sets of button by using one button superior and one button inferior, two sets of button, and this is usually used for bone block surgery if you are using an iliac crest. Nowadays what I am preferring is what is called as a distal clavicle bone block. It's a very good technique because the size of the graft is bigger than the coracoid and it is smaller than the iliac crest, and it fits very well onto the glenoid, and you can vary the thickness. You can increase or decrease the thickness of the distal clavicle based on the actual amount of bone loss, and you can do it, you can fix the bone, and over the bone you can do a very nice labral complex fixation. So effectively what you can achieve is a very good bone loss correction. So a bone block fixed and compressed very well with two sets of button, and over that you do a good soft tissue repair. So at present, for any complicated shoulder dislocation case which includes bone loss or any revision scenario, the best technique to my mind is an OsteoConnect technique in which double buttons are used to fix the bone block onto the glenoid, and this gives a very promising long-term results. Friends, if you have any questions, feel free to contact us on the numbers given below. Thanks a lot.